Are you constantly wondering if your newborn is eating enough? Are you worried you might be doing something wrong? Take a deep breath. In the next few minutes, I'm going to walk you through exactly how to feed a newborn baby. Step by step, whether you're breastfeeding, formula feeding, or doing both. By the end of this video, you'll know how often to feed, how much to feed, how to tell if your baby is full, and what mistakes to avoid. Let's make newborn feeding simple. Section 1. Understanding your newborn's tiny stomach. Before we talk about schedules or ounces, you need to understand something very important. A newborn's stomach is tiny. On day 1, it's about the size of a cherry. By day 3, it's closer to a walnut. After a few weeks, it grows to about the size of an egg. That's why newborns eat small amounts very often. If your baby wants to feed every 2 to 3 hours, that is completely normal. In fact, most newborns feed 8 to 12 times every 24 hours. Frequent feeding does not mean your milk isn't enough. It means your baby's stomach is small and growing. Section 2. Recognizing hunger cues early. One of the biggest mistakes new parents make is waiting until the baby cries. Crying is a late hunger sign. Instead, look for early cues. Turning their head side to side, opening their mouth, sucking on hands, lip smacking, restlessness. Feeding at early hunger signs makes everything easier. Your baby will latch better, feed calmly, and swallow more effectively. Section 3. Breastfeeding Step-by-Step Guide. If you're breastfeeding, let's break it down into simple steps. Step 1. Get comfortable. Use pillows to support your back and arms. Relax your shoulders. Step 2. Position your baby tummy to tummy with you. Their ear, shoulder, and hip should be in a straight line. Step 3. Encourage a deep latch. Gently tickle your baby's upper lip with your nipple. Wait for a wide open mouth. Bring baby to the breast, not breast to baby. A good latch means baby's mouth covers more of the lower areola. Lips are flanged outward. No sharp pain after the first few seconds. You hear swallowing. Breastfeeding sessions usually last 15 to 30 minutes. Let your baby finish the first breast before offering the second. Signs breastfeeding is going well. 6 or more wet diapers per day after week 1. Regular bowel movements. Baby seems relaxed after feeding. Steady weight gain. Cluster feeding is normal. This means your baby may want to feed every hour for a few hours, especially during growth spurts. This helps increase your milk supply. Section 4. Formula Feeding Step-by-Step Guide. If you're formula feeding, here's what you need to know. Newborns typically drink 1.5 to 3 ounces every 2 to 3 hours in the early weeks. Always follow mixing instructions exactly. Never add extra powder. Never dilute with extra water. Hold your baby upright during feeding. Tilt the bottle so the nipple stays full of milk. This reduces air swallowing. Watch your baby, not the bottle. Section 5. How to know if baby is getting enough. This is the number one question new parents ask. Here's your checklist. Your baby is likely getting enough if they feed 8 to 12 times daily. They have 6+ wet diapers after week 1. They have regular stools. They are gaining weight. They seem content after feeding. If your baby is extremely sleepy, refuses feeds, has very few wet diapers, or isn't gaining weight, contact your pediatrician. Section 6. Breastfeeding versus formula. The truth? Let's clear this up. Breast milk contains antibodies and adapts to your baby's needs. Formula provides complete, balanced nutrition. Some families choose breastfeeding. Some choose formula. Some combine both. The healthiest baby is a fed baby, and the best choice is the one that works for your family. Do not let guilt decide for you. Let support, health, and practicality guide you. Section 7. Sample newborn feeding routine. In the early weeks, your day may look like this. Feed burp. Short awake time, 10 to 20 minutes. Sleep. Newborns are usually awake only 45 to 60 minutes before needing sleep again. Avoid strict scheduling in the first month. Instead, follow hunger cues and sleep cues. Section 8. Common feeding problems and solutions. Let's quickly cover common challenges. Baby falls asleep while feeding. Gently rub their feet or switch breasts. Baby spits up. Keep them upright for 20 minutes after feeding. Avoid overfeeding. Sore nipples. Check latch. Use lanolin cream. Air dry after feeds. Gas and fussiness. Burp more frequently. Try paste bottle feeding if formula feeding. Remember, Feeding is a learning process for both of you. Section 9. When to seek help. Seek medical advice if baby has fewer than 4 wet diapers per day. Baby refuses multiple feeds in a row. Persistent vomiting, not normal spit up. Signs of dehydration. No weight gain. Early support makes a big difference. Emotional support section. If you feel exhausted, overwhelmed, unsure, that is normal. This video helped you feel more confident. Stay with me. In the next video, we're going to talk about newborn sleep and how feeding affects nighttime wake-ups. You are doing an incredible job, and I'll see you in the next video.